disorders. So I deal with people having various mental disorders like anxiety, depression, or any other trauma related issues, relationship issues, and even some cognitive issues like concentration, attention problems. So basically, I deal with people who are having mental disorders or psychological issues. Okay, so without any delay, we will start our presentation. Can you all see the presentation?
Yes,
Yes.
doctor.
Yeah, thank you. Thank you. So, the topic for our discussion today is mental health during and after lockdown. So, we start with what actually mental health is. How is it understood? What is the definition of WHO? How WHO defined mental health? According to WHO, it is the state of well-being in which an individual realizes his or her own abilities, that one realizes his own potential, and he'll be able to cope with normal stresses of life, able to work productively, and make contribution to his or her community. So if we have problems in any of these areas, according to WHO, we are suffering with mental health problems. Okay. So if you consider this definition, we all have different levels of mental health. Some are good at some areas, some are not good at some areas. But as we are going through some unexpected times or unprecedented times, this is a kind of stress for all of us. So stress can negatively affect our mental health. So, what is stress? When we talk about stress, what is stress? So, basically, stress means when demands exceed our capability. When demands exceed our capability, we perceive something as a demand, and we also see that we are not capable to meet the demand. Our resources, our energies are not enough to meet those demands. That's when you experience stress. So, it's basically you feel threatened by life, demands of the life. That is stress. So as we all agree, we are all going through unprecedented times, unexpected times. So we all have faced stress. So if nobody is immune to stress. So let's see what are our experiences during this period. So I would like all of you to take a brief moment and think about these two questions. What are your experiences in this period? When you came to know about COVID-19 and when it entered our countries, when the lockdown started, what are all your experiences in this period? Did you pause and reflect on them? Did you become aware of them? When we talk about experiences, we talk about experiences in terms of our emotions, our thoughts, our behaviors, as well as changes in our body. So our experiences are divided into all these four areas. So for example, let's I hope you all have just reflected on what you have gone through during this period, what kind of experiences you have gone through during this period. Let's look at some of the common experiences most of us go through during the stressful periods. First of all, emotions. We all go through emotions like fear, anxiety, frustration, anger, and helplessness, which is nowadays seen because people feel helpless that they are not able to help their own loved ones from being affected. There is a lot of boredom because you are locked down at your homes. There is a lot of a sense of unpreparedness. This is something that we have not expected, and there is unclarity. There is no clarity or confusion about what is going to happen in the future. These are the few common emotions that people experience during stressful periods. And then there are also thoughts that we experience. Thoughts in terms of we worry about what would happen in the future. Like worry is basically in the form of what if thinking. What if this happens? We anticipate mostly the negative outcomes. What if my loved one dies? What if I lose my job? What if I get that virus? And we also think about things about the past, that is called rumination. So we think about our mistakes that had happened in the past. We think about things like I should not have done something, I should have made a different decision. And we also become self critical, that I am responsible for these things, or I'm a bad person, or I'm not good enough, I'm not capable enough to help my family. So we end up in self critical thinking. We also sometimes criticize other people when we are under stress. And there is also fear that we might transmit this virus to other people. So there is a responsibility that you feel. And you also face concentration and attention difficulties when you are undergoing stress. And this is the experience of stress in terms of thoughts. Now we will look at what are the experiences of stress in terms of behaviors. So for example, behaviors like crying. When you face stress, you cry. And there could be disturbances in sleep and appetite. And some people resort to addictions in order to get rid of these unpleasant emotions that they experience during stressful times. Addictions can be addictions which are substance related, like alcohol, or addictions can also be digital, like spending more and more time on internet, browsing, or social media, or video games. So there can also be addictions. Is it not clear? The presentation is not clear.
It's clear, doctor. Just please maximize it. So just to have a bigger screen.
I don't know how to do that.
It's okay, doctor. Just
I
please.
think it's okay. It's okay.
Mhm.
Okay.
It's
Yeah.
okay because yeah, no, that's fine.
Yes.
Okay. Yeah. So so in terms of behaviors, we experience stress like this. For example, as we have seen, crying, sleep and appetite disturbances, addictions. Then sometimes people can resort to overeating, excessive sleeping, because they can forget those negative feelings and emotions. And there can be changes in the activity. The routine might get disrupted. And people also might withdraw from social contacts. And they can also end up in fights and arguments with loved ones. So these are the experiences in terms of behaviors. And we also experience stress in our bodies. Like for example, there is heart rate increase, changes in blood pressure, breathlessness, muscle tension, restlessness. So these are the four different ways, four different dimensions in which we experience this stress. So now, what is the link between all these four different dimensions? So when we deal with patients, the first thing that we make them understand here is that how these four things are linked. The way you think has an effect on your emotions. The kind of emotions you experience can also influence your thinking. The same way, each and every element has an effect on other thing. For example, if you are in a sad mood, you don't think thoughts about I achieve this, I want to do this, I want to do these great things. You think like I will not be able to do these things. So that way, your emotions also would affect your thoughts. For example, if your friend is not lifting the phone, you might think that he is no more interested in me. Then that leads to you experiencing anger. If you think of an alternative possibility, like he may be very busy, he is busy with something else, you may not experience same anger. So the way you think also has an influence on your emotions. The same way, if you think that your friend is no longer interested in you, you might avoid him. That is your behavior. So your behavior also gets affected by your thinking. So if you're angry, your body processes also will change. If you're scared, your body process also will change. That way your emotions and body process are also linked. So if you want to bring changes in any one of them, if you change one of them, you can bring changes in other things also. So that is important to understand the link between thoughts, emotions, behaviors, and physiological processes. Now, one of the areas we look at is our thoughts. What kind of thoughts we engage in? Most of us, we engage in unhealthy thinking, unhealthy ways of thinking when we are stressed. We need to look at what are the unhealthy ways of thinking we engage in. So, few unhealthy ways of thinking that have been identified in research are a need for control, need to have everything under control, need to predict everything, need to have certainty over everything, every outcome. So which is actually not possible. If you look at day-to-day life, nothing you can predict. There is nothing, you cannot be 100% certain about anything. But we tend to look for this control, predictability, and certainty. And there is also a confusion between effort and result. People, what we have in control, in our control is our effort, but results may not be in our control. So you might try very hard to get something, but results depend upon something else. So you expect that if I put some effort, definitely it should lead to the expected result. So that confusion also leads to a lot of stress. There is something called need for approval. Need for approval means I want to be approved by everyone. Whatever I do need to be accepted by everyone. If somebody does not accept me, that means I am worthless. So this kind of thinking would lead you to act in ways that is pleasing to others. So you will not have any of your own wish or your own interest, because you are worried what would others think. So need for approval is the biggest hurdle in our psychological health. And there is also need for perfection. I want to do 100% perfect every time, so I should do it every time 100% perfect, which may not be possible. Somebody who aims at that so takes extra stress, because they spend more and more time on the work that they do, because they are not satisfied with the work they do. They might uh, be afraid of delegating work to other people, because they worry that what if they don't do it correctly. So like that, there are fear of failure. Some people believe that seeking help is a weakness. So even if they are in trouble, they don't seek help. Some people, though they know that what they have done is a mistake, and if somebody points out it their mistake, they may not be able to accept, because accepting means it is a weakness for them. And we also ask certain questions like that do not have answers, like why me, why this happened to me, why now, so which do not have answers. So this leads to a lot of stress, because you keep worrying about those things. There is also inflexibility, like I should always get first mark, or I should always get approval of other people. I should always speak let's say, I mean, others should always speak truth. So when you have these certain rigid rules, then when they are not satisfied, when they are not fulfilled, you end up in stress. So we need to observe whether we are engaging in this kind of thinking. Then there is also how you look at different situations. So what is the perspective that you that you take towards a particular situation? For example, how are you looking at this situation, particularly let's say COVID-19, and how is it affecting your emotions and behavior? For example, there are two ways to look at it at a situation. One is you can perceive a situation as a threatful, or you can perceive the same situation as challenging. If you see it as threatening, you tend to avoid that situation. You will not face it, you will not look for solutions. But in other perspective, if you look at it as challenging, you try to face it, you try to find out solutions for it. So you need to see whether how you are perceiving the situation. It's not only that you perceive the situation as threatening or challenging, you also need to look at how you are looking at your capability of managing this situation. So for example, somebody might look at situation as threatening, but at the same time he might look at himself as somebody who is capable of managing that threat, or facing that threat, or dealing with the threat. Then he may not experience any stress. But at the same time, if you perceive something as threatening, at the same time perceive yourself as somebody who is not capable of dealing with the stress, dealing with the threat, you would experience a lot of stress. So you need to look at how you are looking at the situation. So then if all these ways are dysfunctional ways of thinking, what is the functional way of thinking? What is the right way of thinking that helps us? So a right way of thinking is not overgeneralized thinking. That means based on few circumstances, you will not talk about everything. And functional thinking is, it does not mean to reflect your value or your worth. That means if you fail, it doesn't mean that you're worthless. Or and your functional thinking is not rule based, it is not rigid, it is preferential. And functional thinking is something that helps you achieve your goal. So let's look at an example how this functional thinking operates in our daily life. For example, if somebody who thinks like I everybody should accept me. I should be accepted by each and everyone, otherwise I am worthless, which is a dysfunctional thinking, which leads to sadness and depression. What is the alternative to this thinking? The alternative to this thinking is, I prefer that everybody accepts me. However, it is possible that some may reject me. It feels bad to be rejected, but it doesn't mean that I am worthless. It just means that they have a different preference or opinion, which is more relaxing, which you can deal with it in a better way. Whereas the previous one, that everybody should accept me or I should be accepted by everyone, otherwise I am worthless, which creates a lot of stress and a lot of demands. It puts a lot of demands on the person. Then, whenever we face stress, there are different kinds of responses we engage in. Now, I'm going to ask all of you, and I'm going to ask all of us few questions, and I want us to reflect on these questions. So, in these questions, there are few terms which I have colored in green, and there are few terms which I have colored in red. So, red is maladaptive way of dealing with a situation, whereas green is an adaptive and functional way of dealing with situation. Okay, so I'm going to ask all these questions one by one. Whenever you are faced with a stress, do you react or do you respond? Whenever you experience intense negative thoughts or intense negative emotions, do you suppress or do you accept? Do you try to control them or do you try to allow them to be there in your experience? Do you avoid or do you face? And the other important question I would like to ask is, are you on autopilot mode or mindful mode? What is autopilot? Autopilot is something you press a button and you don't have control over that thing. It's like when pilot puts a plane on an autopilot mode, it is no longer under his control. So same way, when we are in autopilot mode, our behavior is not under our control. Our behavior is under the control of our emotions and our thoughts. But whereas mindful way is, you are aware of what you're feeling, what you're thinking, and you are in better control of your mind and your emotions, where you can act wisely in a given situation. And one more question you need to ask yourself during stressful times is, are you living in the future and past or in the present moment? People who live in the future are they keep worrying about future. What if something bad happens? So it creates a lot of anxiety. People who live in the past, they keep ruminating about what happened in the past, like, I should have done this, I should not have done this, I should have told these things to somebody else, I should not have told these things to somebody else, I should not have made that mistakes. All these things would lead to experience of depression or sadness. Whereas living in the present helps. Living in the present helps you to take a ground and have a perspective over all the things, so that you can respond in a wise manner.
Excuse me, doctor, what's the difference between react and respond?
Reaction is where you impulsively act. You don't think or you don't reflect. You just act. And you realize that you realize we have certain experiences, like we say that, I don't know why I have said those things. I don't know why I did like this. So that means we are not acting mindfully and intentionally. It is something that is happening without our knowledge. That is what react is. Did I answer your question?
Yeah, and respond?
A respond is where you reflect and understand the situation, and based on that you act. So you
Th-
act wisely. You don't act emotionally, but you act wisely.
Thank you. Thank you. Very clear.
Yeah. So we need to ask ourselves, what is the alternative to this? So do we have time to, let's say, slow down and appreciate what is going on? Do we pause and reflect in our lives about our own lives, where we are moving, whether we are focusing on our values or not? Or do you observe and appreciate and notice what is happening around? So do we do these things? Because of our busy lives, we don't have enough time to slow down and reflect on these things. So because of which our focus becomes narrower. That is why we will not be able to have a broader perspective over things, and we make wrong decisions. Now, whenever we experience stress, we experience powerful thoughts and feelings which are natural part of our stress. Problems can occur if we get hooked by them. When I say get hooked by them, it's like we are under the control of our emotions and our thoughts. It's like we are fused with them. You know, a hook. If you get hooked to something, a hook, you will not be able to come out of it. That means your behavior is controlled by your thoughts. Your behavior is controlled by your emotions. You no longer at your will to act accordingly or according to what you want, because your behavior is determined by what you feel and what you think. So, when you are hooked by your emotions and your negative thoughts, what happens is you will not be able to live according to your values. You will be pulled away from your values. So, you will not act as a person you want to be, but you will act as a person who you don't want to be. Like, for example, when you are under your stressful experiences like negative emotions and negative thoughts, you try to react to people, you try to shout at them, you try to have arguments with them, you try to fight with them. So this happens because you're under stress and you're not aware of what is happening in a given environment or at a given moment. So this is what this question is all about. Are these difficult thoughts and feelings hook us and pull us away from our values? So this picture reflects that. When you are under a stressful situation, when you get these thoughts and feelings, you, instead of running towards your values, like having a caring attitude towards your family members, having a loving attitude towards your family members, you might withdraw from your family or you might quarrel with your family. So when we are under stressful situations, when we experience these powerful thoughts and feelings, we get away from our values. Then how to deal with these thoughts and feelings, how to deal with this stress? So one of the ways to deal with this stress is, first thing is to, you need to focus and engage. Focus and engage. So what is engage? Engage is completely paying attention to what you are doing at a given moment. For example, if you are eating, completely focus on what you are doing, what you are eating. Focus on the smell, focus on the taste, focus on the texture of the food completely. And when you are focusing, what happens is, at some point in time you might be focusing completely, but at other times immediately you might get hooked up with your thoughts. You might keep thinking about something else that is not related to what you're doing. Then you might get a worrisome thought, you might get a self critical thought about yourself. So when you notice that, again you got hooked, again you need to notice it, again come back gently to what you're doing at that moment. So this is how you can unhook yourself from these thoughts and come back to the present moment, and focus on what you're doing and completely engage in what you're doing. So the process goes like this: you focus first on what you're doing, whether it is eating, whether it is walking, whether it is drinking, whatever it is, you focus completely using all your senses: smell, taste, touch, texture. And while you're focusing, after a period of time your mind wanders away from that particular thing. And when you notice your mind is wandering away from that thing, without judging yourself that I'm not able to deal with it, I'm not able to focus on it, you gently bring back your mind to focus on the same thing again. That is refocus. That's how you can unhook yourself from these painful thoughts. Then there is something called grounding when you are in an emotional storm. Emotional storm is something where you experience intense negative experiences, intense negative thoughts. Then how to ground yourself? Grounding is like, for example, when a storm begins, if you're on the tree, staying on the tree, it is more dangerous. Once you come back, and once you notice, and once you slow, connect with your body. Notice what is happening in your body. When you notice what is happening in your body, you come back to the present moment. You are no longer in your worries, or you're no longer in your uh, thoughts. So when you come back to the present, then start focusing on the world around you. Pay attention with curiosity to what you can see, what you can hear, what you can smell, and what you can touch. So use all your senses to come back and be grounded. So this emotional storm will not go away because of grounding, but grounding helps you to come to a safe place from where you can act wisely. So now the second thing is you can notice and name what you're experiencing. So most of the problems, like for example, thoughts and feelings hook us because we are not aware of them. So first thing is you need to notice what is going on in your mind or in your body or in your thought processes. So once you notice, you have to name them. For example, you can say, I notice there is heaviness in my chest. I notice there is a thought about what I fear. I notice there is a knot in my stomach. I'm experiencing a kind of knot in my stomach. So it is basically you're noticing and you're naming. The moment you notice your experience comes under your control rather than you being under control of your experience. So noticing and naming helps you to unhook yourself. Then once you are unhooked yourself, then refocus and engage in whatever you are doing. For example, you notice that you're having the feelings of anger when you're having a dinner with your family members. Once you notice, then you come back and you start engaging in what you're doing there. You say that even though I am having feelings of anger, I choose to act on my value of caring by refocusing and engaging with my family. So your behavior is no longer driven by your intense feelings and intense emotions and intense thoughts, but your actions and your behaviors are driven by your values. So here we come across one concept called value. What is value? We will have a look at value in some time. Now, so again, the first thing that you need to ask yourself is, or ask ourselves is, whether these difficult situations or stressful experiences, are they taking me towards my values or they are taking away from values. So then if stressful experiences are taking you away from values, then you need to notice, name them, and unhook yourself, and again refocus and engage so that you act according to the values. For that, you need to know what are those values. But before that, you need to understand this: noticing, naming, refocusing, and engaging, they don't come easily. They are not natural to us. They require a lot of practice because they are skills. So any skill requires practice. So this is like learning a new language, and it takes a lot of practice. And there could be a lot of thoughts that might stop you from practicing, like this is also stupid, it's not important, it will not help, I am too busy, there is no point. So these are all thoughts that can help you, I mean, that can hinder you from practicing these things. Whenever you notice these thoughts, you are hooked to these thoughts, use the same technique of noticing, naming, and refocusing and engaging. So now we come to what are values. So in order to live according to the values, one should know what are our values are. For example, values are they describe what kind of a person you want to be and how you want to treat yourself and others and the world around you. And we need to contrast values with goals. Goals describe what you're trying to get, whereas values describe the sort of person you want to be. Goals can be achieved in a given time or may not be achieved in a given time, but values can be lived by. For example, some of the values can be: you want to be kind, you want to be caring, you want to be loving, and you want to be supportive with your friends, family, and people around. These are the values you can live by. So, as I said, it might be impossible sometimes to achieve your goal, but you can still live your values of being kind, caring, loving, and supportive towards your family, friends, or people around you. Okay. So, now when it comes to values, for example, to be caring, even a smallest action matters in terms of our values. For example, if I want to be a loving son to my family members, a smallest action of calling them and talking to them and finding out about how they are doing, it is a small action, but it is meaningful because it is like I'm living according to my value. So even smallest actions matter when we live according to our values. So we know that world around us is influenced through our actions, not by our thoughts, not by our emotions. Only when we take actions using our senses, our body, or hands and legs, then only we can influence some, we can bring some change in the world. So the more you focus on your own actions, the more you can influence the immediate world around you, the people and situation you encounter every day. So when you act on your values, you begin to create more fulfilling and satisfying life. So what are some of the values? Some of the I have listed some of the common values here. You can have a look at them. To be kind, to be caring. This is not the complete list of values, but these are the common values. So you need to choose what are the values that are more meaningful to you, and start acting according to those values. So some of the values can be to be patient, to be responsible, to be protective, to be disciplined, to be hardworking, to be committed. So these are some of the values, and you can choose values in different domains. Like you can choose values in your family domain, you can choose your values in your personal domain. For example, one of my value in my personal domain is staying fit. So even the smallest value, smallest action of jogging for 5 minutes is consistent with my value. It gives me meaning in my life. So you need to choose to act on your values in spite of experiencing these negative thoughts and emotions. So you might notice that you're feeling angry, but even though you're feeling angry, you can choose to act on your value of being caring about your family. So it is important that we need to know, we need to get in touch with our own values. So whenever we face a difficult situation, we have three options. Either leave the situation, but sometimes leaving may not be an option. For example, if you are in a prison, it may not be an option. Sometimes leaving may cause more problems than staying there. So then that is not an option. Or the third option is give up your values, and which is also not an option for most of us. Then the option that is left is change what can be changed. So this can be done only by acting and accept the pain that cannot be changed. This can be done by grounding ourselves, then choosing to live according to our values. So this is the best option that helps us to live a meaningful life even during the stressful times. Now, sometimes we also become too self critical when we are not able to solve some problems, when we are not able to help somebody, or when we fail in doing some things. So we become so self critical, we become very hard on ourselves. Like, for example, you might tell yourself that I am weak, I am crazy, I did the wrong thing, I am bad, or it is my fault, I should not have done that, I can never forgive myself. So these are the things this we experience when we can't do anything to improve the situation. So these unkind thoughts are natural at times, but they are not helpful if you are hooked by them, because you again get lost in these thoughts and you start feeling sad and depressed. So what you need to do is you need to be kind to yourself. So be kind to yourself. What is being kind? Being kind is, for example, if your friend or if your loved one who is going through the same experiences, same stressful experiences, what are you going to tell your friend? Say kind words to yourself and know that you are a human. You are a human. That means you can make mistakes. You can fail in sometimes, you can fail sometimes, you can succeed sometimes, but in all these experiences you are not alone. So recognize that you are a human. So human means we are bound to make mistakes. We are bound to fail. We cannot act 100% perfectly because we are not gods. So recognizing that we are humans is one of the important step in being kind to yourself. So for example, you might remember a person who has been very kind to you, and you can remember what kinds of words that person has told you, and what kind of body language that he had when he approached you. So and remember those things, and you tell those same things to yourself when you are under these difficult circumstances. Or one of the other ways to be kind to yourself is write a letter to yourself, saying some kind words, or giving assurance, or giving some offering some courage. So being kind to yourself in difficult circumstances helps. And when all these things don't help, there is the other way of dealing with stress is make a room or make room for the stress. Like for example, do not struggle with that, with the stress that you're experiencing. So the stress is experienced in terms of thoughts, behaviors, and emotions. Do not struggle with those thoughts. That means don't try to push them away, don't try to suppress them, just allow them to be there. For example, imagine yourself to be a room. A room is not a collection of things. Okay, if you just keep things together, it does not form a room. Room has its own essential qualities. Room has space. There are different things in the room. These things are part of the room, but they do not form a room. Same way, all these thoughts, emotions, problems, they're actually part of you. They're not whole of you. So you need to recognize that fact, that you are not your thoughts, you are not your emotions, you are not your problems. You are more than them, and they are all just a part of you. So recognizing this helps us a lot, because we can take a perspective. You can imagine a bunch of keys in your pocket, and you can name each of those keys. Like one key represents your negative thought, one key represents some kind of a pain in your abdomen, or one key represents a self critical thoughts that you are bad. You can keep those bunch of keys in your pocket, and still you can continue to do your work. That means you are allowing them to be there with you, but you are not letting them control your actions. So attributing your thoughts and negative emotions to physical objects would help you deal with those intense emotions and intense thoughts. So these are the different ways you can deal with stress whenever you experience. So here ends my presentation, and if you have any questions and queries, you can ask me.
Thank you very much, Dr. Sagar. We appreciate the clear presentation. It is very helpful and informative. And I believe that stress management is essential these days. So we can now proceed with our question and answer portion. I will go ahead with Mr. Khalil Al Balushi. I believe you want to ask a question.
Yes, thank you. I have a question. Eid Mubarak to all. Start with. You mentioned the definition of stress as being demand exceeds capability.
Yes.
Probably, we always need to be under stress, because to stretch our capabilities and get out of comfort zones and challenge ourselves and increase our goals, we need to be always under stress in that sense. But my question is about the values.
Hmm.
Our values are driven. So you mentioned some, like being patient, caring, responsible.
Yes.
Are they
Yes.
driven by how we are, the bringing up of people? Is it the culture? Is it the religion? What is the drive of values of each people, each person? Thank you.
So yes. So first thing, the stress that you are talking about, all stress is not bad. As you mentioned, some stress is good. Some stress actually improves performance. Okay. But when it exceeds, or when you perceive, it is basically the perception. When you perceive that your resources are not enough to meet the demands, and when you perceive the situation as threatening, that's when you feel overwhelmed and you will not be able to deal with that. That's when you experience these stress related thoughts and emotions and behaviors. Now coming back to values, yes, as you said, there are a lot of factors that might influence what you value, depending upon the culture you are born in, and depending upon the religious teaching that you have. But values are something that are meaningful to that individual. What is value to one person may not be a value to other person. Okay, for me, career may be of highest value, but some other person career may not be of highest value. For some other person, religion may be of highest value. They that domain may give may be of highest importance for them. So values are meaningful to that person, and they are more satisfying for that person if they live by those values. Did I answer your question, sir?
Yes, thank you.
Thank you very much, Mr. Khalil and Dr. Sagar. So we will go ahead, Mr. Talal. Mr. Talal, you have a question? You were raising your hand.
Yes, thank you very much,
Dr. Talal.
Dr. Fed, and it's a very interesting presentations. And what I just try to make a reflection with the current COVID-19. Lots of the corporate start triggering something they call it business continuity plan. So as something to survive with the current crisis. And you mentioned in the one of the slide the inflexibility and the difference between the fixed mentality and the flexible mindset. My question to you, how can we move our society or ourselves from fixed mindset to flexible mindset? Is there any exercises or something that we can practice on it until we master the flexible mentality? Thank you very much again, and thank you to Sheikh Khalil and all the team.
Yeah, thank you for your question, and that's a very good question. Uh, yes, being rigid is one of the reasons for experiencing mental health issues. So, if you see the literature, it talks about psychological inflexibility being one of the major predictor of mental health issues. So, developing that flexibility is something that helps. So, as we have discussed about values, our upbringing and our culture has a lot of influence on the kind of mindset we have, the kind of rules that we engage with, the kind of beliefs that we hold in our minds. So, it takes a practice by each individual at an individual level to understand, to know one's own thinking process, and to evaluate time and again, to reflect time and again, and see whether it is helping their goal achievement, or whether it is helping helping them to live according to their value or not. So if it is not, they need to check whether it is a rigid belief that I have, or whether it is anything else. So that way uh, you can focus on that. And the one more other thing that can help is, there is something called mindfulness, being mindful, being aware of what is happening. When you are under stress, your focus becomes narrowed, and you have a very narrower perspective. So you will not be able to take a broader you will not get a broader understanding of things that are going on around, and you will not be able to make a wise decision. So that is the reason you need to start developing an awareness of what is going on in yourself, and pause and reflect, so that you can get a clear picture of everything that is going on, so that you will be more flexible towards that. So one of the ways that research suggests to develop flexibility is mindfulness. So mindfulness is a practice where you focus in the present moment on one particular thing, and without being non-judgmental towards your experiences. Focus on one particular thing in the present moment, being non-judgmental. So like whatever you are doing, you focus completely on that thing without judging that experience, and in the present moment. So this is one of the ways where you can develop flexibility, but it is a skill and it requires a lot of practice.
Thank you very
Thank
much.
you.
Thank you.
Thank you very much, Dr. Talal and Dr. Sagar. May we call on Mr. Simon? Mr. Simon, do you have any
Yes.
questions or clarification? Yes, sir. Good evening.
Yeah, thank you very much. Dr. Sagar, you know, let me tell you what we've been through these 16 sessions. It's amazing because every night we are jumping from one topic to a totally different topic. Last night we were talking about cyber security. And we thought well, definitely for me, it was a huge new thing, you know. And tonight, look where we are. We are in total psychology. It is extremely interesting for one reason for me, because there are plenty of definitions. We, the common of the mortals, all the words we use every day, like stress, like that, we did not have a definition for them.
Yes.
And one very interesting thing you brought to this assembly is definitions. I would like to ask, questions for which I have little answers, but then you will give me the academic answers.
Okay, I'll try
Yeah.
to.
Do stresses change with time, with age, you know, whether in intensity or whether in, because I do believe they change, you know.
Yes,
And
yes,
yeah, the second question is, do values change? And I think yes, principles do not change, but values change. And this is another thing, you know. And that's probably what makes life interesting,
yes,
because values change.
yes.
You learn, for example, with days, then you cannot make confidence to everybody.
Hmm.
So you become reluctant to be, you know. And the last question, which Dr. Talal touched on, can we practice acquire skill when there is no stress? You know, are there actually, and you said yes, focus on your emotions, see what's happening in your body. The one I liked very much is write yourself a letter.
Yes,
That's an interesting one. So to repeat, therefore, do stress intensity or nature change with time? Uh, do values change, and therefore, you know, your guidance, your driver, as Dr. Talal said? And can you train yourself when there is no stress? Thank you.
yes. So, first of all, do stress change? I mean, whether stress changes in its intensity. Yes, stress changes in its intensity, but one of the important thing in the definition of stress is how you perceive it. The same experience or same event may be stressful to one person, and it may not be stressful to other person. So so it is the perception, it is how you view that particular event. Somebody might see it and say that it may not be stressful. For example, giving a presentation may be stressful to somebody, but for other person it may not be stressful. So and over a period of time, if I acquire the skill of presenting, the same thing may not be of the stress may not be of same intensity for me. So as you acquire your skill, the intensity with which you perceive the stress also changes. But one of the important thing is with how you perceive it, because it is not there is nothing in the event, but it is all in the perception. So how you perceive matters, how you perceive a given situation matters. And second thing, if I can move on to the second thing, values are more or less stable. But I agree with you when you said values change when we experience some, let's say some experiences, like for example somebody who has undergone a major traumatic incident, and after that they might relook at their values. Somebody who survived cancer, they might relook at their values. So they change their values, and certain experiences can change their values, but values more or less they are stable.
Yeah.
And I'm sorry, what was the third question that I
Can we
forgot?
practice, you know, during time where there is no stress? I mean,
Yes,
physically, we know we go and do this and we breathe. And psychologically, are there exercises that
yes,
one?
yes, yes. I think you gave me the answer, saying that for example, let's say you do physical exercises which in a proactive way, so that you stay fit and you don't get any illness, and you take care of your food and food habits because you don't get any illness. So that is, you take all these actions even before you face any trouble, so that you develop some resilience, develop some ability in you. Same way, psychologically also you can build your resilience by
That's great.
yeah.
Yes.
Yeah, so psychologically also you can build your resilience. One of the important thing that is important in resilience is developing self awareness, knowing what kind of strengths you are, what kind of weaknesses you have, and how you will behave in a given circumstance. What are your triggering points, what are your thoughts and beliefs? Becoming aware of all these things will help you become self aware, and the self knowledge is the highest knowledge that many people say. So that self knowledge would help you to deal with many different situations wisely.
Yeah. See, if I ask that question, sorry, gentlemen, I'm enjoying the talk. You see, so you can see that I'm not under stress when there is talks. You see, you can see that. Yeah. You see, because the presentation is very, very valuable, but actually it deals with the case when we are under stress.
Yes.
You know what I mean? You say you ground yourself, control your emotions, take it easy, slow down, focus, give it name. All this is during the stress. And my question was, which you answered brilliantly,
Yeah. And thank
it
you.
was for the time outside the stress. Thank you.
And thank you so much for again bringing one more point. That, I mean, even all these techniques that I said that you have to use when you are under stress, if you have not practiced those things when you are not under stress, it is very difficult to use them when you are actually under the stress. So it is also important for these things to be practiced when you are not under stress. So there are times like when you are fresh, when you are relatively relaxed, it is important to practice these things at those times so that you can become proficient at them and use them while you are under stress.
Thank you.
Yeah, thank you so much.
Thank you very much, Mr. Simon and Dr. Sagar. Mr. Haji, you were raising your hand. Hi, sir.
Yeah. Thank you, Doctor, for a very robust presentation.
Thank you. Thank you.
I think we need it at this particular time. My question is very simple. You know, I have a couple of friends at my age. You know, we are above 60 years. And before COVID-19, comfortable, sleep early, you know, raise late, and very comfortable. And recently, they have been telling me, I suppose maybe because of the lockdown and the you know, economical impact on their standard of living, business, and you know, we all know that. And they tell me they are suffering sort of sleep apnea. You know, they don't sleep well. You know, maybe 2 hours, 3 hours. They wake up, especially early morning, 2 o'clock, 3 o'clock. Without
I did that.
realizing,
What did you call it, Haji? What did you call it? Sleep
sleep
what?
Sleep
apnea.
apnea.
Apnea. What does this mean? Anyway,
You will,
I'm asking because I wake up at 2 o'clock.
so, what's your take on this one, Doctor?
So as we have discussed, we are all going through stressful times. We are, I mean, because this is something that we have not expected. Nobody expected it. So there are certain things we worry about, and especially for elder people, this is a worry because news says that they are more vulnerable to these kind of illnesses, and we are also losing our businesses, and we are also there are also losses in our businesses. So there is a lot of worry that we engage in those things. When you are in extreme stress, you keep thinking. So some people call it overthinking, but in psychology we call it worry. So worry is you think about, you anticipate a lot of negative things that are going to happen, and worry creates a lot of restlessness in the body, anxiety in yourself. So you will not be able to sleep. So one of the symptom of stress and anxiety is sleeplessness. So one thing is, I mean, people who worry a lot, they live in the future. So when you live in the future, you have double pain, because staying in the present is also painful. At the same time, when you are living in the future, there is additional pain that you have. So one need to learn to slow down and stop looking at or stop feeding some news which are not useful for us, and start acting, start doing things that we can change, and understanding things that what we cannot change, accepting things what we can change. So the literature whatever the techniques that I've shown you, they are part of something called mindful based therapies, as well as acceptance based therapies, which are found to be most effective therapies in dealing with psychological problems. So but I have not used that jargon, but I've given some principles that I have taken from those therapies. So this mindfulness, where you focus in the present moment, practicing mindfulness, is found to be very helpful in reducing sleep related problems, even reducing chronic pain, reducing depression, reducing anxiety, reducing muscle tension. And it also brings certain changes in your brain structure also, and brain functioning also. So Harvard Health Publishing 2004 has published extensive literature on the benefits of mindfulness practice. So one of the ways that you can suggest them is start practicing mindfulness, which is easy to say, but it is difficult to practice. It requires commitment to practice mindfulness, and mindfulness definitely would improve sleep problems.
Thank you. I have one more question, if you don't mind.
Yes.
How easy it if you are used to the habit of reacting? How can I shift from reacting to responding?
Yes. So again, in any change, the first thing is developing an awareness. If you do not know when you are reacting, under what circumstances you are reacting, then you will not be able to change. So for that purpose, first we need to develop an awareness of what is happening with us. So for that, we need to start observing ourselves, start noticing what is happening with us, under what circumstances. Initially, you may be able to observe after the incident is over, but as you keep observing, keep maintaining a record, or keep monitoring yourself over a period of time, you will become more and more aware. And while you are experiencing, you develop that awareness. You will be able to catch yourself while you are reacting, so that you can stop yourself from reacting and then respond.
Thank you. Just if you don't mind, um, how can we get help from Hope Trust or from you in future? Should we need to have like one-to-one consultation for any particular subject?
Okay, I think
Zoom.
Dr. Rajeshwari is on the line. Maybe she can answer.
Good evening, gentlemen, and Eid Mubarak. There is a way so there we can set up a Zoom appointment with Dr. Vidhya Sagar. We have Dr. Vidhya Sagar, and we have other specialities. For those of you who don't know about Hope Trust, we are one of the oldest centers for wellness. Specifically, we work in the area of addiction treatment. So Dr. Vidhya Sagar is our consultant clinical psychologist, and yes, I in the Zoom ID I am putting up a few numbers and an email ID, and if anybody wishes to contact us, they can write to us with their name and email ID and WhatsApp number, and we'll get back to you. Alternatively, Rose has our and Mr. Haji has our contact numbers. I think that information should help.
Thank you. Thank you.
Thank you very much, Mr. Haji and Dr. Sagar. We have Mr. Muhajir. You are raising your hand, sir.
Hi, yes. My name
Sorry.
That's all right. Thank you so much, Doctor, for your presentation.
Thank you.
It's very, very critical, the issues that you're talking about at this time. I was wondering what your thoughts are from a psychology perspective of, how we relate to each other as human beings in this time. So what this crisis has done to our sense of empathy, to the psychology of prejudice. Everybody's sort of going through the same thing. So everybody's that much more aware of our interconnectedness. So how is this going to affect how we see ourselves, how we see others? How is it going to affect human connection? So what are your maybe predictions in a way of, how humanity will come out after this crisis? Will we be more aware of our interconnectedness? Will we have a greater sense of community and desire to support each other, to be of service to each other? Do you see that happening?
It's a very good question, but a very complex question. What I would say is, now there is a lot of stigma that is going on because of COVID. For example, the place where I live in, we do not allow others to come into our apartments. Our apartment has let's say body which they do not they have what do you call formed rules, framed few rules, which they say that where people are not allowed inside our campus. Okay, so there is a lot of stigma in terms of whether you can allow somebody, whether even if somebody is going through some distress or on the road, are you going to help that person or not? or there is a fear that you might contract that virus from that person. So, and at the same time, there are also news that people are going out of the way to help people, help who are frontline workers, who are daily wage workers, who are suffering a lot. People are going out of the way to help them. So there are both sides of the case. But as you build the awareness of, because there is also no clarity regarding COVID-19, and 100% clarity about how it is transmitted and what kind of cure that it has. So once, as we develop an awareness and as we develop an understanding of all these things and we sensitize the people, maybe I think I would see that as in any other case of any disaster or any other problem, humanity comes first. People are going to respond, and people are going to support each other. So that would be my hope, and that would be my wish, and maybe that would be my prediction also.
Thank you so much, Doctor.
Thank you.
Thank you very much, Miss Lotus and Dr. Sagar.
Thank you.
Do we have any other questions from our participants? Mr. Khalilian, you have a comment, sir. Please go ahead.
Yeah, we would like to take maximum advantage of Dr. Sagar being with us here. Doctor, you were mentioning the overthinking, and you called it worrying in
Yes.
world. But in the business, we are always required to anticipate things, scenarios, sometimes bad ones. What if this happens? What if this happens? Part of the planning there. So how do we match between these two? The second thing is in your when you have clinically the patients, one of the things well known maybe about psychological issues is the acceptance of the patient that he is sick, or whatever we call him. That the acceptance level is always the first and the biggest barrier. How do you overcome this with your patient?
Okay. So yeah. So first, I'll talk about acceptance. I would say one of the things that first that is taught in our training is unconditional acceptance of the patients. Okay, so that is one of the values that we are taught in our training, how to accept each of them, irrespective of what their problem is, irrespective of what their creed and culture and religion is. So I don't know that. I mean, it is something that comes most of us naturally, and some even learn to develop. Okay.
I meant the patient accepting that he is sick.
Patient accepting that he is sick, not we accepting the patient, right?
No, the patient accepting that he is sick, now he's come to seek advice. A lot of people don't,
So
is the
yeah,
first barrier for them.
So we can, let's say we call it insight into his own issue. So whether he accepts that he has a problem or not, whether he doesn't accept, whether he doesn't see that he has a problem. So one of the goals of the therapy itself is to develop that insight in the person, develop that insight that he is going through problem and he needs help. So there are different ways to do that, maybe to help him evaluate his thinking, maybe help him to understand how he is going ahead in his life, whether he is able to achieve his problems, amount of distress that he is experiencing. We bring attention to the fact what he is going through and show him that these are all not normal experiences. Maybe that would help him understand. But and it is also possible that even in the literature it shows that the level of insight is one of the predictor of treatment outcome. If the insight is not good, that means the treatment outcome is poor. So that means there is a possibility that some of them may not even develop insight even after trying hard. So otherwise, one of the goals of the therapy itself is to develop insight, develop that awareness that he has issue. Once he accepts that he has issue, he is ready to work on that.
Yeah. Once he accepted, it is easier.
Easier, yes. I'm sorry, what was the other question?
It's that we are always asked or to anticipate.
Yes, planning. Yeah. So one of the there is a difference between worry that creates problem, and let's say normal concern that we have. Worry is something where you think of worst case possible, and it leads to a lot of negative emotions in you.